these capitalists are always looking for new, profitable outlets for their wealth, they are always pressuring governments to allow the for-profit sectors to deliver services and goods people need. The so-called privatization movement. Since it is often unprofitable to deliver services to all that need them, there will be gaps in coverage, and so it goes. The logic of capitalism is to make profits for the few and shift the costs of the injuries and harms inflicted upon them unto others, principally onto the most vulnerable in society. How's that working out? By the time governments were jarred into action by the coronavirus, evidence indicates that the following mistakes had already been made. Despite the recommendations of the report on what went wrong during the SARS epidemic, the government had not stored up what we now know as personal protective equipment, PPE. And as there was no money in it, the private sector had not produced any, endangering healthcare workers way more than they should have been, and pushing authorities to manufacture false science. Thus, we were told by governments, following the science, of course, that masks were not essential at all. Those Venetians were too primitive for words. Many unnecessary infections later, we have had to recant. Did the science change? From the 1990s onwards, entrepreneurs had persuaded governments that for-profit, long-term care would be superior to not-for-profit organizations, giving them a new source of profit. They gleefully exploited this by further persuading complicit governments to drop all pretense at monitoring and enforcing such standards as did exist. This was an explicit policy of the Ford government. Emboldened by this indifference, long-term care operators reduced the number of workers per patient and hired part-time workers, all too often recent migrants, thereby lowering costs and increasing profits. All this reduced the quality of care dramatically. When the federal government sent in the military to those long-term care facilities, the soldiers reported conditions that were absolutely appalling. And it was not just optics. The fatality rates among residents are sky high. The rate of infections among healthcare workers subjected to those conditions has been horrendous. At the same time, the last decade, it's been good, very good to investors in the for-profit long-term care. Linda McQuaig reports that 3 for-profit operators returned $1.5 billion in dividends to their shareholders, who in turn rewarded their executives with $138 million. We can be confident that these shareholders and executives were not equally exposed to the COVID-19 that rampages through their gold coin spinning businesses. And it is to be noted that these profiteers have not announced that they will give up the gains to help out stricken folk who paid so much money for so little care. Rather, the business papers have been full of accounts of wealthy people thinking about investing in nursing home as the population's ages. Investing in nursing home. Oh, they know a good thing when they have profited from it before. How's that for trickle-down theory doing? How is the economy working? In the line with the last point, as under capitalism, no capitalist has any duty towards anyone else. It should be unsurprising to know the lengths, to actually find out the lengths to which these occupiers of the commanding height of the economy go to hold on to their wealth. They argue vehemently that if anyone needs assistance during this pandemic, it is they. They contend successfully that they need help if they're going to stay in business and return the economy to its previous glories. They have won subsidies to keep workers on their books, with some of the more shameless of them, as reported in the Toronto Star on the 21st of November, using some of the money to pay dividends to their shareholders and bonuses to their executives. They point out that they, rugged capitalists all, need protections from other selfish capitalists who will pursue them for rents. Funny enough, Hudson Bay is warding off its rapacious landlord, Oxford Properties. Cunningly, these positions for handouts are advanced by posting small business capitalists in serious competitive sectors. Like, okay, positing small business capitalists, I see. In seriously competitive sectors, okay, hairdressers, restaurants, gyms, salons, as typifying the plight of all capitalists. Nothing could be less true, less scientific. The concentration of capital, the lack of serious competition in Canada has been established by countless commissions and scholars. The hype about small business being the backbone of the economy is just hype. Having succeeded in persuading governments that the economy posited on avarice is virtuous and is, scientifically speaking, a superior model, capitalists, that is, the members of the class that owns and controls the means of production, have come to swill at the public trough. They demand that if they are to use their assets to make the masks, testing equipment, ventilators, and to invest in research for antibodies and vaccines, the government should step in to make sure that such socially good work yields private profits. If not, forget it. This is the economy, which must be preserved so that it can be opened up. The so-called science it demands us all to follow is more like a religious cult than science. Yet, it is to be preserved by not making the most of the few scientific advances we have made in the last 700 years. The fake science underpinning the economy is trumping established public health science. The reason that the Ford-like governments are not following the science, even as they ask the public to follow the primitive science as developed by the Venetians, is that they think the health of the economy, profiteering capitalists, is more important than public health. This has brought me to that other odious expression. We are all in this together. Some businesses must remain open, no matter what. Healthcare, food, shelter, these are essential human needs. Therefore, small government and private operators that can meet those needs must continue to function. They require workers. Those workers must face the increased dangers of going to places where infections might arise, to travel to and from those places, and then return home to their families and neighbors. They are running risks not incurred by those who can work at home. Personal caretakers, custodial staff, nurses, paramedics, doctors, agricultural workers, many of them migrants on visas, exposed to horrendous living and working conditions, meatpacking workers, construction workers, retail stores, shelf stockers, cashiers, warehouse and storage house workers, couriers, truck drivers, bus drivers, train and streetcar drivers, transport maintenance workers, garbage collectors and sorters, mail sorters and carriers all run tremendous risks. It turns out that Peel, Northwest, and Northeast Toronto are the locales where great clumps of such workers reside, and they're the ones most exposed. They expose more people. The areas in which they live become the hot spots. Work is the core of the problem, and not the fact that these are non-white racialized communities featuring extended families and crowded housing. Those things matter, of course. They explain why, in those hot spots, there are fewer public health facilities, less access to testing, a reduced capacity to isolate infected people, the systemic racism, inequality, and poverty that accompany capitalism, that in the economy play a nasty role. But in the end, it is the fact that during an epidemic of this kind, it is these people in these locales who do most of the heavy lifting for the rest of us. They are the ones who take the most of the risks so that we can retain a good level of comfort and sharply reduce the risk of coming into contact with coronavirus carrying persons. We are not all in this together. Not even close. It is not that our governments and pundits do not acknowledge the sacrifices these workers are making for us. They are called heroes, and grateful citizens bang pots and pans to show their appreciation, but no one does anything concrete for them. Indeed, the rhetoric and the cheap symbolism aside, the focus is the opposite. Central to government and private capital's approach to these heroes is keeping them at work, exposing them and their nearest and dearest to COVID-19. It is no accident that until very recently, hardly anyone suggested that to control the spread of these infections, it was crucial to look at the conditions in workplaces. Occasionally, a scandal would erupt, say, in respect of foreign visa workers on exploitative farms or an unusual cluster of cases in a meatpacking factory. These events were treated as outliers. In fact, with a couple of noble exceptions, local public health authorities were not disclosing any statistics about the incidence of infections in the workplace. One would have thought that following the science would, at a minimum, demand that the decision makers use the data available to them. It took a dramatic revelation by Dr. Lowe, the administrator of public health in Brampton, to make the obvious visible to the government. He reported that since the beginning of April, his staff had investigated more than 1,500 potential COVID-19 exposures in his bailiwicks' workplaces. There had been 116 workplace outbreaks between September 1st and November 13th. He noted that these people had been labeled as essential workers because we, the less endangered sectors, needed their output. However, he pointed to a corollary. The workers that have to do dangerous essential work need food and income. This made it monstrous that many of their employers still failed to take adequate precautions to protect these valuable workers' health, ranking profits over people. In short, the very people who provide our needs, having been paying the price for our continuing welfare and for our expected renewed prosperity when the economy is opened up, our attention has been deliberately diverted from this brutal and verified scientific fact. The version of science we follow has been perverted science, one not based on established facts. The risk spreaders, we are told over and over and over again, are the socially selfish and ignorant people who frequent bars and go to big weddings. Our science perverters are eager to point the finger at COVIDians. From there, it is but a short step to argue that if there were no imbeciles and we all did what we should do, all would be well. A nanny state hectoring replaces policy. Wash your hands, wear a mask, keep your distance, abide by common sense, and all will be well. It is up to you. The science we follow, imbued with the notions of the religious cult we call the logic of the economy is distorted to make us believe that the spread of infections is now attributable to the policymakers' dismal failure to look after the workers, to the failure to test and trace effectively, provide mobile testing capabilities, provide adequate isolation facilities, their willful blindness when it comes to truly acknowledging and dealing with the plight of workers. They saccharinely bathe in praise. In fact, so determined have our politicians been to distract our attention away from workplace infections that they have persistently claimed they really, really care about those workers because they do, essential work. They are heroes. Our leaders tell us because they cater to our fundamental needs. They take the risks. Yet, when some of these workers insist on their legally bestowed right to refuse work that puts them in danger, they have been repeatedly, hundreds of times, told that they are not in imminent danger. That is, they are not taking any special risks at all. For instance, just recently, after an outbreak of infections in one department of a school in Scarborough, Ontario, some 32 staff, administrators, and teachers tried to exercise their right not to work. The Ministry of Labor, note here that it is deliberately not called the Ministry for Labor, said the workers were legally obliged to return to work. Of course, the workers could just quit their jobs, right? It is their vulnerability, their need, which makes them take crowded transport, which makes them do their jobs in dangerous circumstances. To say they are free to quit is just a rank of hypocrisy. Of course, if they feel off color, they could just stay home, right? They could if they had sick pay entitlements. Most of the workers we call heroes, they have no such entitlements. And both capitalists and governments oppose any such mollycoddling of those workers who have so little economic or political bargaining clout. None of this applies to stay-at-home workforce, those hedge fund managers, lawyers, actuaries, managers, researchers, PR and advertising types, web designers, influencers, university teachers even. It is clear. We are not all in this together. We are not following any science worthy of the name. We are, however, pursuing the dictates of a cult, the economy. This is the reason for distorting reason and abandoning compassion. Let's return to that work refusal in a Scarborough school. Why was the school open? Because it is obvious that if schools are not open, it is more difficult to reopen the economy. This is why the workers were not allowed to refuse obviously dangerous work. We know, or should know, that such blatant disregard for human lives will lead to the more infections and perhaps loss of lives. 2 weeks ago, a school in New South Wales found just one student who tested positive. The school was closed. All students and their families and contacts were tested and traced. New South Wales has no community-generated infections. Just saying. There we have it. Our red-blooded Canadian capitalists have been taking handouts to keep them in position to resume normal operations when the economy opens up. Geez, sounds like another country. Sounds like the United States. They are not expected to make any contributions to the resolution of the crisis. They are not required to use their assets, many relaxing in island tax havens. Their equipment, their self-proclaimed expertise, their know-how, their innovative skills to assist, and they don't. Instead, they exploit the circumstances to gouge workers and even other wannabe capitalists. The supermarkets could hardly wait to roll back the pitiful wage increases they had awarded as danger money to their heroic shelf stockers, cashiers, and warehouse employees. Rather, the dominant supermarket chains are using the occasion to demand greater commission payments from their suppliers. As a result, Ontario and British Columbia have both felt the need to set up monitoring bodies to prevent the gouging of the public during the pandemic, an exercise which, thus far, has shown no positive results. More importantly, we now know that capitalists have not provided us with what we need, as opposed to what they educate us to desire. To them, we are profit centers, consumers, not human beings with needs. Essential human needs will only be provided if they can be profitably provided. This is why those very workers labeled as heroes, those whose jobs deliver what we need, are so poorly paid. They are doing jobs for which, it is believed by the profiteers, there are relatively easy ways to create a vast pool of labor. This has opened a lot of eyes. It is now more widely understood that the economy that so-called trickle-down theory produces leaves huge number of peoples in perilous circumstances excluded from meaningful citizenship. This is the economy to which we are so determined to return. It is an economy in which greed and inequality are happily tolerated. It is an economy where we implicitly accept that some people are disposable. Thus, those who cannot take any action to avoid contact with virus carriers, for example, those in nursing homes of one kind or another, and those who cannot be employed profitably, are sorrowfully treated as lambs who cannot be saved from the slaughter. Workers whose skills are seen as easily replaced and whose numbers can easily be added to by migration policies are thrown into the infection pit. It is an economy where its rulers, the dominant capitalists, having been saved by government policies, will oppose any policy changes such as a raise in the minimum wage or the provision of more adequate sick pay. They are certain to also demand restrictions on unionization. God, that might lead to better workplace practices, and will vehemently resist any efforts to have them pay a fair share of the burdens of running a more compassionate society. We can count on this, and we can be sure that they will not feel any pressure to prepare for the next public calamity that may befall us. Capitalism, the economy, is these shameless Canadian capitalists. They don't like, individual are not responsible as individuals. I will say nothing here about the obvious fact that even this claim is untrue, as most capitalist wealth is embedded in collectives called corporations for the public good. We should take them seriously. The virus has been a great educator. It continues to highlight capitalists' appetizing greed. It has brought out capitalism's shameful disregard for human life. It is established that the science we follow is the science that suits this abject capitalist agenda. This is not the science. It's just not a science. It's a political project, and one which is not aimed at benefiting the vast majority, the working class, in capitalist relations of production. We are not all in this together. We should all get together and change this dismal system. That was a really good article, and that was by Harry Glassbeak. And Harry Glassbeak, he's written quite a lot for, I put the links in. He has written a lot, and he's from Toronto, and he writes for Socialist Project, so I definitely think he's worth checking out. I thought that was pretty appropriate for the end of the year. It's a Canadian writer and a Canadian view, And sometimes we in the United States, we think that, oh my God, if Trump won again, we would, laugh about it and say, well, we're going to emigrate to Canada. They have it so much better. And I don't know, I don't think so. A capitalist is a capitalist is a capitalist. Usher in 2021. Whoopee.